Hi, good morning, friends. Today I'll be talking about the hypothesis and the logics of assuming this hypothesis of my particular study. As I mentioned in my previous video, the topic is what is the effect of robotic pharmacy on enhanced accuracy. When I was reviewing each and every website, I understood that as per FDA, there are more than 100,000 cases are reported per year about medication errors. This the figure what I mentioned itself is a significant, and a proper research can help in coming out or reducing the this kind of error. Basically, the main medication errors such as dispensing in incorrect medication, dosage strength or dosage form, miscalculating a dose, and failing to identify drug interactions or contraindication. These are the key medication errors which is happening around. And I would like to explain some of the serious harmful result of medication error. It can cause even death, life-threatening situation, hospitalization, disability, and even birth defect. These are the key harmful results due to this medication error. And from this particular research, I am expecting certain hypotheses based on certain parameters, such as after implementation of robotic pharmacy, it can have a positive impact on enhancing the accuracy of dispensing medicines. The second hypothesis, what I am seeing, is that it can also have a positive impact on reducing the patient's waiting time in the pharmacy. As all of us know, the particular technology or the AI system, it will enable patients, the moment patient reach the pharmacy, it will be ready to collect, ready to pick up. This is a particular system this system is having. The third hypothesis is that after implementation of the robotic pharmacy, it can have a positive impact on the manpower cost. It is definitely a good sign for the management. And also, what I am aiming at this particular study, I'm not, my hypothesis not suggesting only to go ahead with the artificial intelligence system. It is also required human beings. Basically, the particular device can help in terms of arranging the medicine and reading the barcode system without wasting any time and keeping it ready. But always, I would prefer to have a manpower also at the time of dispersing this medicine. Always a personal touch is important and it is required so that it can be thoroughly briefed to the patient and they are well aware about how to take, when to take, what not to do. I mean, this is essential. This is what I am aiming in this particular study. And the rationale of this hypothesis or this study is basically all of us know human error is inevitable. Errors in medication dispense happen because of look-alike or sound-alike medication. Since when human being handled, there is high possibility for error. Basically, few other reasons is like heavy workloads, insufficient staffing, employee stress have been linked to dispensing errors. These are the other causes uh, of these errors. The pharmacist had to hand count, fill, cap, and label patients' prescriptions, which took a lengthy time, as all of us know. This is a reason that basically I am proposing in this hypothesis and the study that a robotic pharmacy or this artificial intelligence system can save a lot of time. It can save a lot of people life because of the medication error. This is a rational why I feel that proposing this particular study. And wherein the hospital where I was working in Dubai, we have launched this particular service 1 year ago about robotic pharmacy. And with the help of barcode and label management system, the artificial intelligence system can support the process, and it can benefit overall the patients. And also why my hypothesis is positive about this system is that all of us know that it can save the headcount and the cost. That is other advantage. And the research method and data collection which I am trying to use in this particular study is that I'll be primarily using the research can be conducted through both primary and secondary sources. In this study, I will use following primary sources such as health records, journal articles, reports, and websites, etc. Secondary sources such as textbook, publicly available data such as FDA report, national healthcare surveys, etc. These are the secondary sources which I'll be using in this particular study. Also, a subjective questionnaire can be helpful. The target people are the pharmacist or pharmacy tech working in various hospitals and pharmacy groups. They are the target audience of this particular questionnaire. And we can have questions like, how many medication errors are usually happening in a month? Second question can be, do you think implementation of robotic pharmacy can enhance accuracy? How much time can be saved to each patient after the implementation of robotic pharmacy? For example, 2 minutes, 5 minutes, 10 minutes, or 20 minutes. It can be given to the each pharmacy staff or pharmacist. And also one more question: do you think any of any of any of sorry, do you think of any drawback of having a system, so that during their experience they might have worked in a hospital where they had a system, and they will have some inputs or feedback, so that it will help us in our study. And also one important point I would like to highlight here, uh, you know, we can also conduct a FMEA study, which is a failure mode effect analysis study. Basically, before starting any such high-tech service or high expensive service, I would recommend any manager to study FMEA analysis. This is basically can conclude them that this particular study is going to be a successful or a failure, or how much risk involved in this particular study. I would recommend based on a severity, probability, and detectability score, we can calculate risk priority number, a RPA number scoring sheet. Based on this sheet and the result of this FMEA study, management can take a proper decision whether to move forward with this particular service or not. So this is all about my hypothesis and the rationale about this study. So I will update during my next video. Thank you. Thank you so much.